A lot of you have asked about my story with statins because I take them. Now, first of all, I'm not paid by Big Pharma. Nobody in pharmaceutical company pays me, and I don't prescribe statins. That's not the kind of doctor I am. But I do have my doctors that prescribe me statins, and I gladly take them, and let me tell you why. I have a form of familial hypercholesterolemia. My father had his first heart attack at age 55, and my brother had a heart attack at age 50, and he didn't make it. So I'm kind of uniquely invested in this. My low-density lipoprotein was over 190 when I started. Using the Mediterranean diet, which I was terribly adherent to, I got it down to about 170, but that's not enough. As with most diet and exercise programs, you can only get it down so far, and in that case, it wasn't enough. So my doctor put me on a combination of Crestor, which is a fourth-generation statin, and Zetia, which is another non-statin medication to help reduce cholesterol. As a result, my LDL is now well below 70, and because of that, I feel pretty confident that I can decrease my risk of heart disease and strokes by a tremendous amount. I wish I would have started them many years before than I did. Here's the thing. On the internet, there's a lot of misinformation and fear-mongering about statins. But let's be clear. If somebody has a reaction to an antibiotic, you don't say all antibiotics are bad. You say, let's do a different antibiotic if they have cellulitis or bacterial infection. If someone has a peanut allergy, we don't say, don't ever eat peanuts. We recognize people don't tolerate certain drugs. And there are multiple drugs that are available that can decrease your risk of heart disease, and you should talk to your cardiologist or lipidologist to avail yourself of those medications if you need them. But let's be clear. Medical misinformation on the internet, fear-mongering, clickbaiting, is something we deal with all the time. And part of my job is to help you navigate through this mess and base things on science and evidence. Whereas these other people will say weird little clickbaity things like you don't have a deficiency in statins, let's be clear. Heart disease is the #1 killer in America and has been since the turn of the century, since 1900. The only year it wasn't was in 1918 from the influenza pandemic. Heart disease has decreased in the United States by about 5-fold since the 1950s. Part of it is decreasing in smoking, part of it is less emphasis on saturated fat in our diet, and part of it is the new use of the drugs to decrease low-density lipoprotein. So if you have this as a disease, don't wait until your calcium score is positive. Don't wait until you're positive for disease. See your doctor, get it under control, and if you have reactions from statins, there are other drugs that they can help you with. All right? If you like getting rid of misinformation, that's what I'm here for. Like, follow, share.